Do you have a bunion? Are you worried that your only option is surgical intervention? Make sure you check out this video. I'm going to give you a great option where you can avoid bunion for your surgery, treat your bunion effectively, conservatively, and avoid getting a bunion like your mother. My name's Daniel Fitzpatrick from Sydney Foot Solutions. We see stacks and stacks of bunions, in fact, well over 100 bunions a week, and we get really great results and have done for over 20 years, unless your bunion is really extreme and you have to consider the surgical options. But make sure you check out this video. I'm going to take you through what a bunion is, how it works, give you proof that we can help you with a bunion by referring to one of our really positive reviews about a bunion treatment, and I'm going to take you through a patient named Suze that we helped avoid needing bunion surgery. So Suze wrote, and you can check this on our Google reviews, so to make sure I'm not making it up, but Suze wrote online, "I highly recommend Sydney Foot Solutions, incredibly professional and friendly practice. Daniel Fitzpatrick is very knowledgeable, experienced and ethical, and saved me discomfort and avoid me having to pursue surgical options. Highly recommend going to them for consultation and treatment." And we thank Suze for taking the time to give a review, but also trusting us with her health. And we're extremely grateful for her giving us a review. And so the great news is that we've got lots of really positive stories like Suze, and we're absolutely thrilled we can help people avoid bunion surgery. Because keep in mind, bunion surgery, the surgeons do a great job, but the reality is bunion surgery is very expensive. It's a significant recovery time, as in 6 to 8 weeks off your feet and then months before the swelling stops. It's a really big deal, even though the surgeons do a great job, and only needs to be considered in extreme cases, in my opinion. And so if you're wondering, you might be thinking, what is a bunion? So a bunion is where you have a deviation of your big toe. It's a very broad term that describes one of a number of different conditions, and sometimes it can result in a bump out the side, sometimes it can have a deviation through here, sometimes it can cause flare-ups through that particular area there. And you might say, what causes my bunion? And a lot of people think it's because they wore high heels or they wore bad shoes, and those things can contribute. But primarily a bunion is caused by the way you stand and the way you walk, which is affected by a level of subluxation or misalignment through this area here, which affects the way you stand, the way you walk, and causes you to internally rotate. So the good news is, if you improve the way someone stands and the way they walk, and also strengthen the relevant areas, you can have a really positive effect on the alignment of someone's toe and help to straighten out their bunion. And the two main treatment options that are available to you are that the one that everyone knows about is the surgical intervention. And the surgical intervention is primarily where they break these bones and then they pin the toes so they're nice and straight, and they shave the bone off. And so it's quite a big deal, very well done, particularly in this country, but at the same token, there are some risks associated, very significant costs. In fact, if you Google it, costs for bunion surgery go anywhere from $5,000 up to about $8,000 for your average bunion surgery, and that's per foot. So a significant amount of cost associated with that. The other treatment option is one that we offer, is manual therapy, where we can work on correcting that level of alignment. It's a very gentle hands-on technique, and we give you exercise to support those changes. The great news is we take before and we take after x-rays, and we actually it's a very objective style of measurement, and we can actually double check that things have improved significantly. And we get lots and lots of success with that. In fact, we have done that treatment on people's bunions for over 20 years. We've got over 25,000 cases that we have seen through our clinics. So it's a very wide stream. It's a mainstream style of treatment. It's not woo. What I would suggest, though, is if you are interested and you do have a bunion, the key is to try and get onto it as soon as possible. Obviously, like everything, when was the best time to see your bunion? Probably 5 years ago in most instances. When's the next best time? Tomorrow. So we would encourage you that if you are considering trying to treat your bunion conservatively or manage your bunions conservatively, I would get on it. I would recommend that you get on it sooner rather than later, and we would strongly recommend that you do that. We see stacks of bunions. In fact, for our limited, or at the moment, we have a special offer of 60% off an initial bunion assessment. We can come in and get your bunion assessed. You can get it double checked, and we can give you professional advice that's relevant to your bunion and help you avoid the need for bunion surgery. Go to info@sydneyfootsolutions.com.au or click on the link below and follow the special offer.